Hi, my name is Sussan Nwogwugwu. I will be presenting my DMP project, Effectiveness of Telepsychiatry in the Treatment of Adult ADHD during the COVID-19 pandemic. I hope you enjoy my presentation. I obtained my bachelor's degree from Babcock University, located in Ilishan-Remo, Ogun State. My master's degree was from Maryville University, located in St. Louis, Missouri. My DMP is from Maryville University, located in St. Louis, Missouri. I work at Done First, located in San Francisco, California. My chair is Dr. Teresa Galacticos at Maryville University, St. Louis. My peer or community person is Maimona Sal. She is a psychiatric mental health nurse practitioner at Mental Health for All, located in Washington State. And my faculty is Dr. Lisa Storer from Maryville University in St. Louis. Attention deficit hyperactivity disorder is a chronic and highly morbid neurobiological disorder affecting a significant population across the globe. Its effects among adults are pervasive, including occupational underattainment, separation and divorce, and a high risk of disabling complications such as anxiety disorder, depression, antisocial disorder, bipolar disorder, and criminality. Current evidence shows an increasing trend in the rates of adult ADHD, but slower detection rates, especially amongst minority, racial, and ethnic groups. According to Song et al., the worldwide prevalence of ADHD was 6.76%, equivalent to 366.33 million persons in 2020 alone. Adults with ADHD require ongoing therapy and support to alleviate the symptoms and maintain their functional status. However, access to diagnosis and follow-up services remains challenging because of limited access to experts. The recent COVID-19 pandemic exacerbated the problem by creating barriers to the delivery of face-to-face services. This quality improvement project focused on alternative approach in delivering services to adults with ADHD. My project aimed to confirm the efficacy of telepsychiatry in achieving patient satisfaction, building a therapeutic relationship, and enhancing the quality of care among adults with ADHD. The project was guided by a Piker question among adults with ADHD. What is the effectiveness of implementing telepsychiatry compared to face-to-face services in sustaining patient satisfaction, therapeutic relationship, and quality service delivery within 8 weeks? The COVID-19 pandemic has imposed a considerable burden on the delivery of healthcare services across the globe. Since the pandemic start, governments swiftly placed restrictions on individuals, services, and workplaces to control the spread of the infection. Consequently, this raised concerns about the short-term and the long-term effect of the restrictions on the delivery of mental health services. A principal problem that emerged entailed access to mental health services. research indicates that the use of telehealth grew from 14% to 28% between 2016 and 2019, with an increasing trend observed following the start of the COVID-19 pandemic. According to Connolly et al., telehealth visits increased by approximately 56% between March and April 2020. The accelerated rate of using telehealth services shows the growing importance of the modality in service delivery to patients with mental health problems. However, the service setting continues using face-to-face sessions, which has led to missed appointments in reaching a significant number of ADHD patients. Telepsychiatry may pose tangible problems because of the high levels of distractibility. However, it could also address some of the issues of ADHD that ADHD patients face, including disorganization. Implementing telepsychiatry is expected to influence service delivery and significantly increase patient outcomes. The project addressed the aesthetics pattern of knowing by improving providers' awareness of the immediate practical situations in their endeavor. Aesthetics is concerned with the art of nursing that fosters creativity in designing and providing effective and satisfying nursing. Therefore, the project goes a long way in emphasizing the essence of empathetic acquaintance to degrade psychic detachment that can potentially hinder telehealth. It is also worth noting that the study cultivates the transformation of the delivery system to provide more medical benefits. Change is inevitable and must be embraced once it surfaces. For this reason, the project motivates ADHD patients to prioritize telehealth. Although telehealth cannot entirely replace the traditional in-person approach, it deserves to be popularized. Overall, this model equips APRNs with a strategic view of the medical field. They are triggered to establish interdisciplinary relationship in their quest to meet and exceed patients' needs. This approach is vital in nurturing their prowess to interact with diversified patients. Relationships are critical aspects of a competitive nurse as they help improve the overall health outcomes for individuals and their families. The APRNs will gain a competitive edge by enabling them to deliver services. A comprehensive search for supporting literature was conducted from several health databases, including CINAHL, Medline, and PsycInfo. The primary keywords used include telepsychiatry, ADHD, telemedicine, telehealth, video conferencing, e-health, telecare, teleconferencing, missed appointments, no-shows, canceled appointments, patient satisfaction, efficacy, and acceptability. The terms were combined appropriately to develop appropriate search strings that would enable the identification of appropriate literature. The articles included were published between 2016 and 2020 in English language. Only primary research, including randomized controlled trials, cohort studies, and individual quantitative or qualitative studies were selected for inclusion. The initial search led to the identification of 57 articles 24 duplicates were eliminated, leaving 33 articles for consideration. Abstract and full text screening of the remainder led to the elimination of 13 additional articles, leaving 20 articles for inclusion in the review. Four themes emerged from the literature. The themes were developed by grouping literature addressing the same concept. Patient satisfaction emerged as one of the most reported outcomes associated with telepsychiatry. Assessment of the efficacy of telehealth or telepsychiatry on symptoms shows that the modality is equally efficient as face-to-face clinic visits. In their randomized controlled trial, Myers et al. Reported positive effects of telepsychiatry on children with ADHD. Challenges in completing visits and attending appointments are common in mental health settings because of the logistics or the challenges or personal difficulties such as forgetfulness that patients with ADHD experience. As such, telepsychiatry is employed to reduce the number of missed appointments, including no-shows and cancellations. Guinaud et al. Illustrated the positive effects of telepsychiatry on appointment adherence. From a sample of 1,064 participants, the study found that 39% reported that telepsychiatry reduced the likelihood of missing their clinic appointments. While telepsychiatry has positive effects on patients' no-show rates and satisfaction, the evidence gathered identifies several barriers and facilitators worth considering. The barrier and the facilitators could be associated with the attitude of the healthcare professionals, subjective patients' perception of the platform use or technology, and technological issues with the identified technology. Peplau's theory of interpersonal relations was the overarching theory supporting this project. The theory emphasizes the development of rapport with patients, families, and caregivers to support and encourage the development of positive relationships. According to theory, nurse-patient relationships pass three crucial phases, and these include the orientation phase, the working phase, and the termination phase. During the orientation phase, nurses must seek and acquire essential information from patients to determine their unique needs, preferences, and priorities. The working phase accounts for the majority of the time clinicians interact with the patients. The clinicians have developed familiarity with the patient and work collaboratively in the majority of the time to interact with these patients without any judgment. The termination phase occurs when clinicians teach patients about recovery and symptom management at home. The phase that is crucial in this project includes all the phases because it could reflect the extent to which the working phase functions throughout the project. The use of the theory enables the clinicians to optimize patients' experiences by focusing on the interpersonal aspects of the interaction. Roger's diffusion of innovation model also serves as a crucial role as a conceptual framework underpinning the project. The model integrates four primary components, and these include knowledge, persuasion, and decision, and implementation. Knowledge, persuasion, and decision are the first components that determine the adoption or rejection of an innovation. Exposure of an individual to an existing innovation leads to the acquisition of knowledge about its function and mechanisms. In turn, individuals reach the persuasion stage after forming views towards the innovation pertinent to the attributes such as complexity, simplicity, compatibility, and relative advantage. The decision phase entails the involvement of the individual in activities that will require them to make a choice about using or foregoing the innovation. As such, they make the decision to adopt based on the best available evidence and positive experience with the innovation. In this project, exposing the participants to telepsychiatry and educating them about its components will generate the appropriate knowledge that could influence adoption of telepsychiatry. This QI project used a before and after exploratory design to accomplish its primary goal. The design was essential in revealing the temporal relationship between an intervention and the outcome of interest. The investigator focused on patients' no-show rates and patient satisfaction pre and post implementation of the QI initiative. Before the intervention, the normal operation at the facility focused primarily on face-to-face interventions for ADHD patients with no proper emphasis on telepsychiatry. The primary investigator instituted the intervention in collaboration with the psychiatrist clinical manager, the registered nurses, and other support staff. During the 2 months, an education program was used to enlighten the patient on telepsychiatry presence and its potential benefits. Data collection involved a retrospective chart review without direct patient engagement after IRB approval. The project author accessed the electronic health medical records for patients in the list using a temporary password and kept the list in a locked cabinet. In turn, each EMR was reviewed to assess whether it met the inclusion criteria. The inclusion criteria required that the patient participant must be between 18 to 65 years old, diagnosed with ADHD, have been treated at the healthcare facility throughout, and have experienced either telepsychiatry or face-to-face treatment. Quantitative data were retrieved from the EMRs to collect no-show rates pre and post implementation. 389, including 189 pre and 195 post patient EMRs, were randomly selected for the QI project. In addition, patient satisfaction scores were retrieved from the facility's database for pre and post implementation data collection. The facility's patient satisfaction survey or questionnaire was used as the tool to collect this data. The pre-implementation data was composed of data collected during the traditional method of care also known as the face-to-face service delivery to the patients over 3 months, including January, February, and March of 2019. In January 2022, telepsychiatry was implemented as a replacement for face-to-face consultation. The post-implementation phase ran through January, February, and March of 2022. The data collected were tallied at the end of every week and organized into weekly data, each month having 4 weeks ready for analysis. The data analysis phase started after the required number of EMRs highlighted on the list were reviewed. The data was cleaned to ensure only no-shows and patient satisfaction data was available. Patient satisfaction was analyzed as a categorical variable, which means standard deviations and frequencies indicating the changes over time. The project was not resource intensive since it did not require many resources. Human resources were required to facilitate the review of the medical records. The project required a personal computer or laptop for the abstraction and analysis of data. The project also required several data sheets in which raw data from the EMR were filled. The investigator seeks assistance following the de-identification of the EMR data. The project followed a specified timeline to achieve the expected outcomes. The first week involved seeking approval to use patient data from the EMR. In the second week, data collection began. Week 3 involved data extraction using the data collection sheet, while week 4 involved cleaning the data by identifying and eliminating errors. Data analysis was conducted in week 5, and the dissemination of findings was completed in week 6. Descriptive statistics is an important aspect of every research process that entails vast data sets. In this case, descriptive data were used to examine the current and the previous approaches to attention deficit disorder management amongst adult patients. The sample size was 389, which included 189 pre and 195 post-intervention. In the pre-intervention phase, 54% samples were females and 46% were males. During the post-intervention phase of the participants were 122 of the participants, which approximated to 63%, were females. 37%, which is approximately 73 of the participants, were males. A lower tail z-test for the differences of the two proportions were utilized to determine the significance of differences in no-show rates between telepsychiatry and physical consultations or in-person consultations within 3 months. Adult patients with ADHD exposed to telepsychiatry had the statistically significantly lower no-show rates when compared to adults with ADHD not exposed to telepsychiatry. It is what pointed out that the main results have been presented in a table format in the main paper. The outcomes of the quality improvement project reflects a significant decrease in no-show rates amongst adults with ADHD when telepsychiatry was implemented as a substitute for face-to-face intervention. Equivalently, there was a significant improvement in satisfaction in post compared to pre-implementation of telepsychiatric care. These outcomes were confirmed statistically significant as reflected in the Z-test. The results can possibly be justified by the increased accessibility and convenience of telepsychiatry. Though the adoption of telepsychiatry was expected to yield reduced no-show rates, it was not given that the reduction rate will be so significant. However, the results amounted to a substantial reduction in no-show rates with an effect size of negative 0.69001011. This admirable and unexpected outcome was greatly contributed by the fact that research was conducted during the phase of COVID-19. As the prevalence of ADHD heightened, the project advocates for increased adoption of telepsychiatry as a viable mode of delivering mental health services. Besides, the project implicates that effective implementation of telepsychiatry, healthcare providers must be provided with training and ongoing support to ensure proficiency in using telecommunication technologies while maintaining effective therapeutic relationship. Healthcare policy plays a significant role, especially in regulating new medical technologies. Cognizant of this role, the project seeks to ensure sufficient reimbursement and funding mechanisms for telepsychiatry services. Given the use of telepsychiatry is projected to increase significantly, there is a dire need to revise reimbursement policies to ensure it is covered as a means to incentivize providers and expand its services. Besides, the policy should streamline the licensure and credentialing process and establish reciprocate agreement to facilitate telepsychiatry services across diverse jurisdictions. Technological infrastructure should be assessed and continuously improved to guarantee secure platforms for telepsychiatry services. Healthcare organizations must scrutinize the reliability and interoperability of telecommunication technologies to avert the risk of any breach. Recommendation is geared towards reinstating better outcomes in the modern age of technology. It is also imperative to implement ongoing quality improvement initiative to progressively monitor the safety and effectiveness of telepsychiatry. Drawing on the obtained outcomes and insights, it is evident that telepsychiatry is incredibly beneficial and impactful in reducing no-show rates and increasing patient satisfaction. Consequently, providers are encouraged to embrace it in their service delivery model. Healthcare facilities should also consider developing patient education materials and resources to enhance compliance. It is crucial to implement collaborative care models that foster coordination and communication to promote telepsychiatry. Finally, telepsychiatry should be fully integrated with EHRs to foster continuity of care. I hope you enjoyed my presentation. I am open to questions and recommendations from the public. Thank you so much for watching my presentation. Here are my references for this project. Have a great day. I'll see you next time.